Okay, good morning, everyone, or afternoon also at this point. Thank you for joining us today for our SBIR and STTR workshop, specifically about NIH and the Phase 1 program. I also have to say, I hope everyone forgives me. I'm sitting here in a jacket. It is very, very cold where I am right now. So I apologize for that transgression. But we're going to dive through a little bit in detail about NIH, their SBIR and STTR programs, what they're about, what they focus on, and also some of the assistance programs that are available in New Mexico. As this is a collaborative workshop with New Mexico Bioscience Authority, I'm going to let Stephanie from NMSBA kind of open us off here and talk a little bit more about her organization. Stephanie, if you want to take it away.
Sure. Let me unmute myself. So thank you so much for joining today. I hope that you all received the invitation from the various sources. I know that New Mexico FAST and Arrowhead, as well as myself, were sending it out to a lot of the state, just because we are a state entity, the New Mexico Bioscience Authority. I am the executive director of the Bioscience Authority, and I'm just here to tell you a little bit about what we are and what this new program is that we've recently launched, which is why we reached out to Dell to ask him to host this workshop. So I think you have to, yeah, there we go. So for us, what is bioscience? We use the 6 industries that have been defined by the Department of Labor. We recently had a discussion with one of our new board members to include biofuels, bioproducts, and carbon sequestration under the header of agricultural feedstock and chemicals. And so that is the first sector. And then we also have bioscience related distribution, drugs and pharmaceuticals, medical devices and equipment, research and bioinformatics, testing, and medical laboratories. And like Dell will point out, a lot of those sectors, research related to those sectors and innovation related to those sectors do fall into NIH, but Dell and I have also talked about that there are a number of other agencies that also have SBIR, STTR training, grant available to be able to fund that kind of innovation. Next slide. And so this is our board. We have gotten one more new board member since this. Sarah Bover is also a member of our board. And so that picture does need to be revised to include her. But you can see that we have representation from across the state, from all of the main research universities, as well as individuals appointed by the governor and the legislative council, as well as the Secretary of Economic Development and the Executive Director from Spaceport. You may go to the next slide. And this is our staff. So there's me in shorter hair days, and Sterling Nichols is on the call. I know he's our program specialist, and Ryan Cangliosi, if he's not here yet, he will be joining. He's our strategy and policy director. Next slide. So this is the program that, like I said, is why we reached out to Dell. So our board recently approved us to launch a bioscience business accelerator program. I am coming from 10 years of research development prior to coming into my role as the executive director. And so I have a lot of experience working with faculty who are interested in submitting proposals. And so what we're looking at right now is expanding a federally funded program that is already being led by UNM. It's a bioscience business accelerator that currently works with NMSU and UNM, but because of its funding structure is not necessarily able to include other universities or other entities throughout the state. And so what our plan is to expand what they have already done in terms of training, mentorship, workshops, and network facilitation to support the commercialization of all bioscience innovation throughout the state. And so this workshop is part of that ambition. then we will also be having other training opportunities down the line. And I'm really hopeful to be able to help with proposals. I will not write proposals, just letting you know that, but I will edit proposals, and I will help to make sure that they are fitting in with the solicitation, and that it is a topic and writing structure that is ascertainable from a higher, from the people who are going to be reviewing your applications. So I look forward to helping out with that. If you go to the next slide, you'll see our contact information. And so there are all of our emails. Something that we include in a lot of slides when we're talking specifically about the authority is that we are affiliated with UNM. And so they are our administrative unit, which is why all of our email addresses are through UNM. But our website is down below, where you can go and look at all of the other programs that we also offer, and sign up for our newsletter. So thank you so much. And thank you, Del, for giving this presentation. I look forward to it.
Yeah, no problem at all, Stephanie. And, thank you for reaching out to us. We're really excited to be able to talk about, the SBIR and STTR programs, particularly through the lens of NIH. And for everyone, don't worry about scrambling to write down email addresses or links to websites. We will be sending these slides out after today's session and after we post the recording, because this is being recorded, just to make sure that everybody that wants this information will be able to access it. But to the meat of our session today. So the SBIR and STTR programs are an excellent opportunity for both businesses as well as research institutions for a couple of different reasons. And the focus today, we're going to kind of dive through the presentation in this format, is we're going to give an overview on the SBIR and STTR programs. So just from that 35,000 foot level, what are these programs? Why are they of extreme benefit to small businesses? And why can they help move technologies out from the labs and out from the research institutions to that commercial pipeline or that market opportunity? Then we're going to talk specifically about NIH, how they run their SBIR and STTR programs, because one of the things that you will find is there are a number of agencies that participate in these federal funding opportunities. We're going to dive into that here shortly. But each one is vastly different, how they approach it, what they do, what their proposals look like, what their funding cycles are like. There's a lot of variation there, and there's just a lot of either misinformation or confusing information, because it does get confusing. Even from a support side, sometimes it's a lot of information to keep straight in our heads across these different agencies. Then we're going to talk about the actual proposals. So what are some of the kind of critical things that are very necessary to write what we always like to call a complete and a compelling proposal package? Then we're going to talk about some of the assistance that's available, and hopefully leave about 5 to 10 minutes available for some questions and answers. But to get us started here, so what are the SBIR and STTR programs? Well, the SBIR and STTR programs, SBIR has been in existence for something like 30 years now. STTR, not as long, I believe it's around 20 years, but they are a vehicle for the federal government to inject research and development dollars into small businesses. Now, there's a couple of caveats that come with that. They are business focused. So there has to be, it's not just research for research's sake. This is very applied research. There has to be something that can be created. There has to be a market for it. There really has to be commercial potential. There has to be a pain point it's addressing. There has to be a fit for it in the marketplace. At the end of the day, there has to be somebody that's interested in paying for this, because these are a way for businesses to grow, businesses to succeed, and businesses to belay technical risks. So if you have something you're going, God, this would be such a great idea. If only I could get this, or if only I could figure out how it works, or, oh, it's going to take so much time and effort just to see if this is feasible. I don't know if I can do this. I'm kind of thinking about just throwing in the towel right now. That's why these programs exist. Now, it's also a great way to just validate that there's some potential here. There's something that I can move from invention to innovation. And I always like to bring that fact up because for anyone that's not in the know, there's a huge difference between inventions and innovations. Inventions are, well, I'm going to kind of stretch the boundaries of what we understand, what we know scientifically. Innovation is, I'm going to do that because I can sell a crap ton of these. I can make a lot of money doing this. And that's really the key difference is inventions are great. They kind of let us figure out what is possible, what exists. Innovations are also really great because it takes that and it goes, this is something that the market needs. This is something that people actually need. This is a product that needs to be out there. Now, SBIR and STTR are very focused around businesses. They are a way to grow businesses, but it is a way, particularly for STTR, for businesses and institutions to work together. We always like to kind of give this landscape of what the programs look like. Across the federal landscape, there are, we call it 12 agencies. It's technically 11 agencies, 12 departments, because Department of Commerce has NIST and NOAA. But there's a lot of federal agencies and research development agencies that go, we need to provide something back. We need to be able to grow these things. The ones in gray are the ones that actually participate in STTR, which is a vehicle to move inventions that may be sitting on the shelf to the commercial marketplace. And every one of these agencies participates in the SBIR program. Now, there is a bit of nuance to these programs that people definitely need to be aware of. These are very, again, business focused and business driven. Small business will always be the awardee. They will always be the manager, but that doesn't necessarily mean that there's no place for research institutions to fit in. With SBIR, a business can say, well, I can do all of this on my own, or I may need a little bit of technical help. I may need a little bit of assistance, or there's some great resources I need to tap into at the university down the road. So on an SBIR, the business can subaward out up to essentially a third of the work. They can go, well, I need a little bit of assistance. Let me bring this institution in. Now, in STTR, they typically tend to be a little bit more research focused across the agencies that participate in STTR. They see it as a way to really take that early stage invention and figure out what's possible with it. It's a lot of that kind of validation on, I've been doing some work in my lab. I think this can actually turn into something. Let me figure this out. Now, the small business is always the main awardee, but on an STTR, actually 60% of the work can go to a research institution. It does require a research institution, and research institutions are just organizations that are receiving federal dollars to perform research. So universities, national labs, some other weird one-offs for labs. There's an entire list out there that exists, but it allows that research institution to go, we need to do a lot of technical work, and that small business to go, I can help with that. I can help figure these things out, and I can commercialize that. It also allows a little bit more flexibility in where that kind of thought comes from and where the effort comes from, because the principal investigator on an SBIR has to be primarily employed, so 51% of the time by the small business. On an STTR, out of the 5 agencies, 4 of them allow the PI to come from a research institution. NSF is the one holdout, which kind of sucks because NSF funds pretty much anything science related. NSF says, come talk to us. But the great thing is with NIH on their STTR, the PI can come from the research institution. So that was a just kind of brief little bit of background about these programs, just again, focused around the fact that they're a way to take that idea to the commercial marketplace. And when it comes to health, NIH is the biggest agency that people need to be aware of when they're trying to figure out that pathway, that potential, and that way to move forward. So NIH on their SBIR and STTR programs, it's run out of Health and Human Services. There are 27 institutes and centers across NIH that each focus on a different thing. You know, you have like NCATS, the National Center for Advancing Transitional Sciences. You have NIAID, which does allergies and infectious diseases. So each one kind of has their own bailiwick for where they want to focus, how they think about health, and how they think about kind of providing better health. Out of those 27 ICs, 24 of them actually participate in these programs. So there is a wide variety of, I'm working on this, you know, I want to provide better solutions for people that suffer this malady. I want to provide better solutions for how you do point of care. There's a lot of that opportunity across these different, let's just call them sub-departments within Health and Human Services. And we always like to say, well, HHS is the kind of organizer, but NIH is the focus because NIH has the most footprint into these. But Centers for Disease Control and FDA also are part of these programs. So there are opportunities under both of those kind of sub-programs within NIH for funding into SBIR and STTR. And NIH is really great with these programs because they're one of the most, let's just call them aggressive agencies when it comes to how can we support these? How can we actually show that there's capability and capacity here? How can we help these businesses or these ideas move forward? Because there's a lot of complementary opportunities under NIH for SBIR and STTR. So it's not just about the phase 1, phase 2, it's also about commercialization readiness. There's really great programs under NIH to actually fund FDA testing, which, if anybody knows, can take a long time and require a lot of money. There's some really great commercialization assistance programs. NIH has a full breadth of kind of development assistance that they offer under SBIR and STTR. Now with NIH, there's a couple things to be aware of when you're thinking about how do I fit within these programs? What do I need to know? Each year NIH releases what they call their omnibus, which is just the collection of everything they're doing SBIR and STTR. And they have 3 funding cycles a year under that. So typically January, April, and September is when proposals are going to be due. But NIH also does targeted solicitations for things like crisis areas. So if there is a big, let's just say, maybe there's a pandemic that's shutting things down around the entire globe. Well, they'll have a targeted solicitation going, hey, we got to figure this out. We got to figure out healthcare for this. We got to figure out things like vaccines. We got to, innovate how we do that point of care for people that are suffering from this. So they'll release a targeted solicitation that's more like a contract where we go, we need a solution. We need to actually purchase these. We need to make sure this gets out there. So those targeted solicitations are on a rotating basis. Just as that need arises, as that critical event happens, there's going to be an opportunity to get funding under that. So when you're looking at NIH, kind of be aware of that is they have 2 very different mechanisms when it comes to SBIR and STTR funding. It's either just hey, these are things that would be cool if they eventually hit the market, and hey, we need to solve this huge problem right now. Across NIH, there is a focus on just technologies that will improve health and save lives. When they talk about that, they really do cover the gamut of things related to health, biotech, and biosciences. Each of the institutes and centers, because they are so focused on a specific malady or a specific kind of system within the human body a lot of times, then their missions and their research priorities are very different. But just because you have something that you go, well, this isn't for autoimmune diseases, or this isn't for allergies, or this isn't for infectious diseases. Even if it's, well, I'm figuring out a way to create a better digital record, or I'm figuring out a way to actually collate information together so we can make data-driven and data-informed decisions about how to provide better healthcare. There are a lot of different institutes and centers under NIH that do focus on things like that. So maybe it's for improving well-being. Maybe it's for healthcare related to AIDS. Maybe it's enabling new tools and drug assays that are going to, shorten the time to market for things like vaccines. There are a lot of different areas just related to health in general that NIH says, you're creating something that could be really cool. You're creating something that could actually, save millions of lives. Let's see if we can fund that. Now, when you are looking at NIH, it's not just about kind of that omnibus and targeted solicitation. NIH is very subdivided, let's call it, under the different institutes and centers. And what I mean by that is I'm going to stop saying institute and center and just call them IC, because that's what NIH calls them. So when you hear me say IC in the future, that's what I'm talking about. It's just a lot shorter to say. So each IC can have their own level of funding, their own periods of performances through things like topic waivers. So with NIH, their kind of standard phase one is $259,613 over 6 months. Do not ask me why it's that very specific figure. I could not tell you. And phase two is, let's just call it 1.7 million over 24 months. But different institutes and centers might actually go outside of that bounds. NCATS is a really great example. They say that, with waivers, we can provide up to $600,000 over 24 months for a phase one. That's why it's very important to actually reach out to these program managers, to reach out to the different IC, support staff and say, I'm working on something. I think it fits with what you're doing. I see that there's a waiver here that I can actually apply for more funding or a longer period of performance. Do I fit within your mission? Do I fit within your priority? Because they can tell you yes or no. And that will, change greatly what you're doing, kind of what you're going to focus on in that phase one, that scope that you're trying to develop, that research priority that you're trying to say, those aims that you want to do. Funding, kind of drives the world. So if you can get more funding to actually develop a better product at the end, that's something that you want to capture. So when you're looking at those opportunities, kind of be aware of that. Is NIH is very similar to DoD in that facet, that there's a lot of variation even within NIH. Now, I did say that, NIH does fund a lot of different areas of health and healthcare, and people always go, well, but I don't think I fit. You more than likely fit if you're touching health in some fashion. And here's just a couple of very quick examples. NIDA is very related to substance abuse, but they include things like nicotine. So if you're developing a better nicotine patch, or if you're developing, better cigarettes that don't have as much nicotine, or even alcohol abuse, then that is actually substance abuse. They consider that under their funding area. NIEHS deals with environmental health. And it's not just environmental health, but it's also looking at ways that the environment that is around us, so, climate change, more, smog in the air, more impacts from industrialization. How is that impacting health? What can we do to actually mitigate that? What can we do to alleviate that in some fashion? So if you're looking at healthcare and, health benefits from that area or that kind of wheelhouse, then it's possible that NIEHS will be interested in funding that. Things like NHGRI, which is genomic research. Well, yeah, they're really interested in genomic research, but also in kind of those ethical, legal, and social implications of using human genome research. So if you're looking at better ways to kind of make people understand about what genomic research does, then there might be a funding opportunity for you. And one of the ones that I always like to throw out that is very interesting is NCCIH, which is Integrative Health. Integrative Health is particularly interesting for a lot of people across New Mexico because there's a really big push in New Mexico for alternative care systems, that kind of point of care for the holistic body rather than the traditional care for, post-surgery, things like that. So if it's acupuncture, acupressure, meditation styles, things like even yoga, those are considered alternative care. And it's something that NCCIH could possibly be interested in funding because they do look at how that integrative care system and that integrative health, how those alternative methods can actually strengthen the results of traditional care. So it doesn't really matter what you're working on when it relates to health tech, and biotech. There is more than likely a funding opportunity for you under NIH. And as Stephanie kind of mentioned in her opening, it's also not just about when you're thinking health, NIH isn't the end all be all. As I mentioned, NSF funds everything across science. So as long as you're just not doing drug discovery or drug development, NSF is more than likely interested in funding it. They will fund anything and everything related to science, discovery, engineering, those kind of things. But there's also other agencies that touch health in very kind of strange ways. Things like USDA has some very specialized areas of health tech, particularly when it looks at the impacts for rural communities. And that's really big in New Mexico because most of our state is rural. So if you're doing something that's going to provide better societal impacts for rural communities, rural health, it might be something that USDA might fund as well. And people often overlook two of the bigger ones when it comes to health, which are DoD and NASA. They go, well, I'm not developing better bullets, or I'm not developing, rocket flight systems. Why would I fit into those? Well, both of those organizations have a lot of people. DoD has a lot of warfighters. So if it's for, theater of war care, if it's for better, rehabilitative care once a wounded soldier comes back, then that could be a funding opportunity under DoD. Or if it's going to help protect astronauts on, manned missions to Mars, where they're going to be 3 years in a giant box rocketing through space, they got to figure out how to, care for those astronauts. They got to figure out better ways to, keep viable drugs so that if they do come down with something when they're 3 million miles away from the surface of the Earth, it's not just, oh, well, hope you make it through. There's a lot of opportunity for health and health innovations just across these programs in general. So when you're thinking about the possibilities, are these programs right for me? Is it something I can approach? Don't just look at NIH. Look at some of the other agencies, because you can actually get multiple awards through multiple agencies and do them at the same time, actually have them running at the same time, as long as they're for kind of different things you're focusing on, or maybe it's for different innovations. It's not just well, I'll apply for this and this is the only one that's going to fund me. Take advantage of all the funding that's out there. Take advantage of all of the opportunity that's out there to help you get to that marketplace, to help you be commercial ready. Now, that's a really great introduction on, hey, these programs are really great. They provide funding. It's a great way for you to move to market. It's a great way for you to kind of figure out that feasibility, solve those critical technical challenges. But like everything, it comes with a cost. And the cost is you're going to have to put together a proposal package. Doesn't matter which agency. Every single agency requires a proposal package in some format. And what are those elements that make for a strong proposal? Because if you're a researcher, you're probably used to writing proposals. You've written proposals to NSF, you've written proposals to NIH for academic work. But these are not academic proposals. They are at least typically very, very different than anything you've written, because again, they are business focused, they are commercial product focused. So there's some things you should be aware of when you're looking at those opportunities, when you're looking at that timeline on what does a proposal actually look like? What are the things that make a strong proposal? Because there's going to need to be some research. There's going to need to be some data gathering. So when it comes to the phase one proposal, phase one is really about validating feasibility. You're addressing a critical technical challenge, or you're addressing a critical, problem that you go, man, this will be really great, but I just don't even know if this is feasible because there's this one thing, there's this one overarching thing. Yeah, you're going to have a lot of problems. You're going to have a lot of challenges with developing a product. It's product development. Product development takes a long time and a lot of effort. There's all sorts of things that could go wrong. But if you were looking at that house of cards or that Jenga tower and you say, this is my critical problem, because if I push on this piece and it falls, everything comes apart. Well, that's your focus in a phase one. What is that thing you need to show that you're not solving it in phase one? You're just going, if I had more time, if I had more funding, I can actually solve this because I've proven that it's feasible to address this problem here. Now, again, different ICs within NIH might have different topic waivers, might have different, kind of periods of performance or funding. But it's just good to think about it as roughly $260K for 6 months to actually address that, do that research, do that work, do that testing, do that, validation in the lab or in a controlled, real world environment that shows that this has legs, this is potential. And one of the things that people often do when they're looking at, well, which IC do I, submit to, or even which agency? A lot of times they'll go for the biggest bang for their buck. They'll say, well, this one IC really aligns with what I'm doing because that's their entire focus. But I could double my money if I go for this other one or this other agency out there. Maybe I can triple the funding available to me if I do that. And sometimes that's a really great pathway, but sometimes you're cutting your legs out from under you because different ICs might have complementary, programming around that. Or it might be that because it's such their focus that it's going to be easier to, I always hate saying easier to win an award because there's a lot of mitigating factors that go into that, but they're going to be more interested in it. You're going to get kind of not lost in the noise of all the other proposals that go in. So don't just go, well, there's more money here, I'm going to go after this. Just make sure it aligns with your goals. What are your goals of doing this? Why did you want to do this in the first place? Why are you doing this kind of research? What is it about this problem that you want to take care of? If they focus on that problem, that IC or that agency is going to be much more interested in how can we help support this? How can we make sure this gets to market? Because that is the purpose of these programs, again, to take that idea to the marketplace. So they want you to succeed. They want those businesses to grow. They want to support those innovations being a commercial product at the end of this. So there's going to be other opportunities. They're going to help you along. And the ones that provide the most bang for the buck when it comes to assistance, it's a lot of times worth more than the money that actually comes from this. With the proposal, another thing to know is that if this is kind of your first award, you can either do a standard phase one under NIH, a fast track, or a direct to phase two. A fast track is just essentially, I can do all of this stuff. I have everything laid out. Let me run through the phase one and phase two at the same time. So when you put together that proposal package, you're actually submitting both of those at the same time. You're writing a phase one and a phase two proposal and submitting all of that right then. Now, direct to phase two is a little bit different because you're actually skipping over the phase one. You're going right into phase two going, I've already proven the feasibility. I've done all the research work I need to do. I've shown that this is possible. I just need to start developing that prototype. I need to start developing that. What is this solution going to look like? What do I have to do to lock this down? Because you say, well, I've already done all the stuff I would do in a phase one. I just need phase two funding. Now, they do have that ability, but keep in mind that because it's more money, because it's a longer funding period, they're going to be much more thorough. It's typically very tough to win a direct to phase 2 because usually there's always something that you can do to, show expanded feasibility or show expanded research. So while you can do a direct to phase 2, never really recommend it. It's a lot of work for a lot of times, not a lot of payoff because it is very, very, very hard to win a direct to phase 2. So for that reason, we're really going to focus on the phase 1 proposal here. Now, when it comes to content, you can't really, again, recycle things that you've done academically, or you can't recycle things that you've submitted to another agency. There's going to be some very key differences between, well, one, between the agencies, but two, between NIH and every other agency. I always like to tell people that there are 3 styles of proposal. NSF, you kind of have the same information as other agencies, but you put it in a different format. You actually don't have as many sections. You have to combine stuff. So it's not really an easy copy and paste, but you can kind of get it done. Those other agencies kind of fall into one bucket where it's like, it's pretty much the same form, fit, and function. You're just moving a little bit of information around and retitling headers, doing a little bit different focus depending on which agency you're looking at. So using different verbiage, using different wording, whatever that is. NIH is a completely different animal. Their proposal package looks nothing like any other agency. And so that's why you can't just easily recycle stuff with NIH. Yeah, you can pull information, but you're going to want to rebuild it from the ground up. Because unlike other agencies that typically have a 15 to a 20-page technical narrative, with NIH, you have a 6-page research strategy, which is your technical narrative. And you have a very short project summary and what they call a project narrative, which are 30 lines and 3 sentences, respectively. So it's not a lot of technical writing, but you need to support that writing with a lot of research, a lot of references, a lot of citations, a lot of detail. And NIH is very focused on the team you have. So what are their expertise? What is their capability? What is the matrix of people you've put together that makes sure that this is going to be done? So for that reason, NIH uses a 5-page bio sketch for anyone that is going to be a senior or key person. And senior or key person is anybody typically that is actually named. So if they're named on the budget, if you're providing funding directly to them because they have specific expertise or research acumen background that you want to be able to utilize, then you're going to need a bio sketch for that person. And you have a 1-page specific aims, which is, hey, I'm going to do this. It's like kind of that project abstract. You pull the information out of the 6-pager, put together the 1-pager. This is actually what I'm going to do. This is why it matters in a phase 1. And the good thing about that specific aims is, 1, it's a requirement for the proposal, but 2, it's also the one thing you want to do first because you want to use that to introduce your idea to those program managers. Remember, I said that you can actually reach out to those IC program managers, talk about your idea, make sure it fits within their research focus, make sure it fits within the mission of their just little department within NIH. And you want to do that. That is a critical first step because it lets you know, is that going to be the best opportunity for me? Is there something that I'm just overlooking? Is there something I'm going, I can do all of this work? And when a reviewer finally gets it, they're going to go, there's no way they can do all of this in 6 months with this amount of money. They will give you that first buy-in. And you want to use that specific aims because it has that information. Again, it's kind of that high level abstract. And then just like any other proposal you put in, there's going to be a budget justification, and a whole bunch of various forms through, they call it ASSIST, ASSIST, that is actually built off of grants.gov that you want to use for NIH. It's a much prettier system than grants.gov. It's a lot easier to navigate. But there's going to be a bunch of forms you're going to have to fill out. Are you doing human testing? Are you doing animal, modeling? Are you actually taking in vitro samples? There's going to be things that you have to fill out on there saying yes, no, and if yes, Why? What are you doing with this? How are you protecting these samples? How are you protecting data? How are you actually humanely euthanizing animals at the end of this? So just be aware that there's a lot of different mechanisms, there's a lot of different pieces that go into these proposal packages. But diving a little bit into some of the information here. So I said that one pager, that specific aims, is a really great kind of start, because even in your finalized proposal package that you submit, it is that introduction into what are you doing? What's that overview about the problem? Why is there a current gap right now? What can you do that other people just aren't doing? What can you do better? Why have you actually figured this out? What is so different about what you're creating, kind of how it's going to look, how it's going to operate, how it's going to process, whatever those critical differences are that make you better than the quote unquote competition. And you're going to outline kind of 2 or 3 things that are very specific that you need to do. So a very specific type of testing, very specific type of modeling, a very specific assay tool that you're going to run that shows that in 6 months this animal model proves out this. Those are really those kind of objective-based things, and you're going to give an overview in them in the specific aims, because those are your research aims. NIH uses the term research aims rather than technical objectives, which everybody else uses. Another critical difference between NIH and any other agency. And you want to show just, why am I doing this now? Why does this matter for me to show this feasibility? It's just really that high level, this is what I'm going to do, this is why it matters, this is why you should care. And not only is it a great way to introduce program managers to the idea, it's a great way to get letters of support, because letters of support are very important for any agency. They're pretty important for NIH as well. And letters of support you want to get from people that would actually be affected by this going to the marketplace. So, potential customers, potential end users, things like that. Having a letter of support from a research colleague, in your resume is great. For these programs, it doesn't really matter, because how is that research colleague going to buy this? Why do they actually impact the commercial success of this? And that's what you want to think about with those letters. Who is going to impact the commercial success of this? Can I get an investor to actually give me a letter? Can I get an end user to say why this product actually hitting the market will really affect their health and their longevity at the end of the day? Now, again, the research plan is kind of your technical narrative. It really, you take that one pager and you expand on information. So you're diving into that kind of summary of that problem. What are the references out there? How many people suffer from this? What does this actually do to not only the health landscape, but also the economic landscape of America? Because these are very America focused. What are you going to do to actually affect health across the United States? It's not that you can't say this is going to be a worldwide, kind of health situation, but first and foremost, they're going to want to focus on what does this mean to the US in general. You're also going to dive into the innovation, and you wanted to actually describe what this is going to look like. Is this going to be a one-time thing? Is this going to be a new treatment plan? Is this going to be a better data assembly? How is that actually going to work? And show a theoretical model, show how this actually looks, because having something like imagery or visual components are very important in these proposals, because these are going to go out to reviewers. And you always want to make sure that the picture you're painting with your words is the exact picture that comes into that reviewer's mind. What better way to do that than to just show them the picture? Don't make them think the picture up. Just show it to them. Show them why it's important. Point out why they should actually pay attention to this. Point out what elements they should pay attention to. So for a really good research strategy, you kind of want to focus on that. When you think about the actual problem and the significance, how pervasive is this problem? How are you going to change people's lives by actually developing this? When you're looking at the innovation and talking about that solution, Remember, again, focus on why this is revolutionary. Why did you figure out something that nobody else has figured out? What is the key differentiator there? And for that approach, you don't want to just kind of give that high level, this is what I'm going to do. You want to actually break it down. It is kind of that research strategy. What would your research plan look like? You know, going back to the scientific model, you have the problem, you have the hypothesis, you have some experiments you're going to do. You want to provide that level of detail. What are you actually going to do? What are those individual actions you're going to take? Why do they matter for showing the feasibility of this? You know, what are the results? How are you going to validate those results? How are you going to make sure that there's not bias in your results and of the research? You want to really talk about that. That's why when it comes to that 6-pager, your approach should pretty much be at least 3 to 4 pages of that. You know, a 1 page on the significance, or even half a page, you know, 1 page on the innovation. And you really want to dive into that approach because they want to make sure that you kind of know what you're doing. You know, yes, you are developing this, and maybe you have 20 years of experience and publications in doing this, but show that to them, give them that detail, completely break it down. They're going to want to see that breakdown. So that's why your approach is going to be a very long portion of that 6-pager, because you want to provide that level of detail. I'm not going to dive too deep into biosketches here because everybody knows what a biosketch looks like. But the one thing that makes NIH different from their biosketches and other things is the very, well, after the typical contact and, you know, hey, I went here, got this degree information that is in every CV. The next thing you're going to do, and one of the most important things, you're going to write a personal statement. And anybody that puts together the biosketch needs to write their own personal statement. The personal statements across biosketches do not need or cannot be just copy and paste. That actually stands out to reviewers. They want to be a very personal, this is why I'm doing this. This is why I care about this problem. This is why I care about solving this. That really resonates well with those reviewers. They say, okay, no matter what trials, tribulations, or challenges crop up, they're going to see this through. They really care about solving this problem because it takes a lot of effort to get to market. It takes a lot of effort to actually develop that product. There's going to be a lot of challenges along the way. There's going to be a lot of hurdles to cross. They want to make sure that you're going to keep at it, that you really care about this. You care about this getting there. And that personal statement really resonates well with those reviewers and showing that. Because this is kind of a treatise on, I'm going to do this and I'm going to see this through. And you want to provide that level of information that showcase that I can do this well, and this is why I can do this, because that's what they care about. Now, when it comes to that kind of phase 1 process, you're going to start off by looking at those documents, kind of selecting that topic that you're focusing on, selecting that IC that's going to be interested. Then you're going to want to get registrations in place, again, because these are business focused. It's the business that needs these registrations. So things like a DUNS, a SAM, a SBC control ID through SBIR.gov. And then you're just going to kind of follow and flow through. Again, develop that specific aims first, because that is your introduction to those program managers. You're going to send that over, ask a couple specific questions, and ask to have that follow-up conversation, kind of drive into the heart of, this is why I'm doing this. This is why this matters. This is why you should care. You're wanting to show them why they should actually care about what you're developing, because that is going to make it stand out. That's going to make them remember you. And that's also going to be a great way that you know exactly how to format that proposal package, how to write those different sections, because that's kind of your grading rubric. That's your cheat sheet in a way. Another critical thing that people often overlook for the last is developing that scope. It's going to be one of the first things you want to approach, because what you're actually going to do, the work you're going to perform, drives your budget, drives what you can do, and drives, hey, is this something that can actually happen? Is this something I can, test out? Is this something I can show is feasible? And then just secure those team members. Again, both of these programs allow businesses to work with research institutions, to work with researchers, expand that team, bring in other people, bring in those partners. Make sure you have that really good, solid, just strong team that's actually going to be on this effort, because NIH wants that. They want you to show that. They want you to showcase that. So do that early, because if you need things like letters of support, letters of commitment, bureaucracy within research institutions can take a while. So lock those down, contact those people as soon as you can, share that aims with them. Say, this is what I'd like to do. I'd like to have a further conversation on how you can be part of this effort. And then, you're going to move through a bunch of these steps. A lot of you have written proposals before. I'm not going to tell you stuff that you already know. But one of the critical things that a lot of people overlook is getting outside review. Send this once you think you're finished, once you think you have everything, laid out, once you think you've answered all of their requirements, send it to somebody who does not know what you're creating, who doesn't know, who hasn't lived, breathed, ate this, solution, this research problem, this whatever you've been doing for the past 5 years. Make sure they understand it. Send them that kind of criteria, that review criteria that each agency publishes. Have them go through it. Could they understand it? Do they know why it matters? Do they know what you're going to do? Because we tend, as just humans in general, to kind of overlook things that we think everybody knows. Well, I know this. Everybody else should know that. Well, are you sure everybody else knows that? Send it to someone who doesn't know. Make sure that they actually understand what you're putting together. That can actually really increase your ability to win awards, because reviewers that get these are going to do the same thing. They don't know you from Adam. They don't know what you've been doing. So you have to convince them from the ground up. And yes, the reviewers are going to be in health. They're going to actually typically have some experience within that larger problem set, but they may not have very specific experience in like how this one disease transmits across the blood-brain barrier. They may know about the blood-brain barrier, they may know about the disease, but they may not have that kind of intricate technical understanding and technical depth. And so that's why you kind of want to also approach these from the ELI 5. You're explaining it to them like they're not totally into what is being created, like they haven't done it before, like they haven't published 20 papers on it, because they may not have. And another critical thing, always submit early, particularly for these proposals. These systems go down a lot. The systems actually can cause errors. If you wait until the last second and maybe you don't have a registration in place that you weren't aware of, maybe something comes up, maybe a document gets corrupted and you don't have time to fix it, the window closes. And then they go, okay, well, good luck in 3 months when the next window opens, or 4, however long it is between January and April. So you want to always submit these early. Now, NIH also has a couple of other kind of companion programs just to know about. I'm going to give a really brief overview about a couple of them here. One is the Niche Assistance Program, which kind of just lets you jumpstart that commercialization effort. They say, okay, this is something that could be commercialized. Let's get you some resources. Let's get you some help. Let's get you some commercial people that kind of know what they're talking about and can help you figure out that market. Another one, and that's available to any SBIR awardee. Another one is the ICorps program. So NIH runs its own ICorps program where you actually go out and do that customer discovery, talk to people. You do have to have an active award. So these are really great opportunities that come along with a phase 1 that funded SBIR or STTR phase 1, because it does allow you to establish that commercial pathway, establish that market fit, establish that value proposition, and start to make those efforts towards, this is going to be a product. This is how I need to, it's not a real word, but quote unquote, productize this so that people can buy this in the future. Now, I've given you a lot of information and people's heads are probably swimming at this point about the differences in agencies, the differences in proposals, how you need to address it, how you need to focus it. And people are going, this kind of seems insurmountable. Is this actually worth it? Well, it is really worth it because it's non-dilutive funding. They're not going to take any equity. They don't want any part of the idea. It's really the only way to get in outside money where you don't have to dilute what you're doing, give up part of the company, give up part of the idea. And because of that, we have the NMFAST program. So we are funded by the SBA to provide assistance to businesses across New Mexico going after these opportunities. And we do a lot of that kind of one-on-one guidance and support. So how can we have a lot of tools and resources, templates, compliance matrices, videos. We give workshops like this, and we just make sure that we help demystify that process. Because again, there's a lot of moving parts, there's a lot of variation, there's just a lot of critical things you need to know. So what can we do to show that to you? What can we do to make sure you're putting together those strong proposals? So anything from reviews to kind of that tailored support. Like Stephanie said at the beginning, the one thing we don't do is write proposals, so we can't help you create copy, but we are always willing to go, no, you need to focus towards this, or here's some ideas, or just really bounce stuff off of you going, yeah, this sounds great, but you really need to focus here. This is what they're going to be looking for. And one of the things that we also do is yearly, we have what we call our Innovation Summit. This is going to be December 15th this year. And the reason that I always like to tell people about this is a great day of panel sessions, just talking about SBIR. This year, we're going to have ones on things like data rights, things like third-party investment, kind of some tips and tricks, and actually with NIH awardees that can say, this is the way I approached this. This is how I got that award. This is how I continue to get awards. One thing that's different this year is we will have people from NCATS. So NCATS is one of the ICs within NIH who will be able to sit down one-on-one with people and talk more about what they're developing. Is it a fit? How do they move through these programs? So if this is an opportunity you want to make, or if the SBIR and STTR programs are something you want to go after, I recommend attending this. It is virtual and free. Again, these links will be active in this proposal, so you can register now, and we just hope to see everybody there because it is a great source of information. It's a great source to meet the people that can actually drive those decisions on what you're creating. And, now just like to open it up to some questions if anybody wants some. I also have time after this to meet one-on-one with people. If you want to meet with me, just let me know. I'll set something up with you. And you just apply to our program. We provide a lot of support for people going after SBIR and STTR. We do a lot of information. We know a lot of things. We can kind of help you figure out, is this even a pathway? Copy and paste the Innovation Summit registration link in the chat. Yes, I can do that. Let me actually do that right now. Give me 1 second. But so that's the Innovation Summit. But for everybody else, are there any further questions? Would anybody like to kind of tag me and say, hey, I want to know more about these. I want to know more. Oh, let's see. There's a couple of questions here. Okay, one question. How would we recommend someone outside of the medical field to secure team members? Again, develop that specific aims. I want to do this. And for kind of figuring out people that could be part of this, a really great resource is going to be the research institutions across New Mexico, so the universities. And I'm sure that, Stephanie at Mexico Bioscience Authority could probably help make some connections there. Not to put you on the spot there, Stephanie, but is that something that your organization can help do, is connect them to maybe some medical researchers?
Yes, if information, just send me the information. I can put my email address in the um, chat and I can see what we can look up.
But, again, start off with that kind of one pager. What are you creating? Why do you think it's going to help with health? And reach out to, Stephanie, reach out to me. We'll try to connect you with, maybe there's somebody, a researcher at Sandia, or maybe there's somebody at Lanel that can help you. Or maybe there's actually a healthcare organization, an industry organization we work with that would love to partner with you on it. Sherilyn, the well put together proposal package to share. So agencies are notoriously reticent to share funded proposals, but under NIH, the National Cancer Institute has some really great examples of funded proposals. Let me also make sure that this is in the digest that I send out. I'm trying to find it right now. But they actually have a really great resource library that will showcase some of the funded proposals from before, so you can see how other people have put together their proposal packages, how they've actually been able to win. Here we go, sample applications. So on this website, look at the sample applications, and it'll show you how people have actually approached these programs, how they've created their phase 1 proposal, and kind of what they focused on. And there's a much better one out there that's not on this one that has, probably 40 different applications that have been successful to show you how other people have approached the programs. I'll make sure to find that and actually send that out with the notes from this session and the link to the recording. But if that is going to wrap it up for our session here, if there are no other questions, but thank you again, everybody, for attending. You'll have you have my email address from the notice that a reminder I sent out to everybody. Reach out if you are interested in SBIR and STTR. This is a great way to get funding for that idea. And if you're in New Mexico, we can provide assistance. We can provide that help. We can, share our tools, resources we've developed, the ungodly amount of videos that are on our YouTube channel that dive into each aspect of the proposal process. And this is our bread and butter. This is what the SBA funds us to do, is to help businesses come up with those. Can this be a good application? Can this be something that an agency is interested in? Thank y'all again. And, reach out, let us know how you want to move forward, how we can help y'all. And I hope to hear from everybody.